As of 5th of March, when the UK first reported its first coronavirus-related death, and the 31st of July, the nation has reached an official death toll of 45,999. The lockdown restrictions had eased up in most parts of the UK. However, as of 9th of September, the lockdown restrictions have tightened up again. And from Monday, the 14th of September, you are only permitted to meet in groups of 6, which is down from the initial proposed 30. And the reason for this is that the rates of infection have gone back up again, with local city lockdowns of Birmingham, Northampton, Manchester, and 1 or 2 other places. Generally, seasonal illnesses such as the flu virus are less prevalent in the summer. So what do our prospects look like in the winter with the presence of the coronavirus? Let's find out. But before I do this, let's get into a new set of clothes. Okay, that's better. So let's get straight to what I'm talking about today. So will the coronavirus be more dangerous in the winter? The UK's chief scientist, Sir Patrick Vallon, has found that approximately 120,000 deaths could occur in the UK with the second wave of winter infections. Early on in the pandemic, it was thought or suggested that the pandemic would get worse in the winter. However, this was largely due to early coronavirus modelling based on the flu virus, which does get worse in the winter. So as a result of this, both scientists and advisors were closely following a well laid out plan for the flu, which explains why a policy of herd immunity was suggested.
And one of the theories is that, perhaps you could sort of kick it on the chin, take it all in one go.
However, as time has passed, it has now become obvious that the coronavirus does not operate in the same way that flu does, which gets worse in the winter. The reason is because with the dried, cool air, the virus particles separate and spread further, as compared to in the summer with the warm, moist air where this does not happen and the virus tends to die. So the good example to look at is Australia, where there's been high peaks of infection both the winter and in the summer. Also in other hotter countries in the tropics where there's been increasing rates of infection. So the COVID-19, well, the evidence so far suggests that COVID-19 does not follow or operate in the same way as the flu virus. Other factors to consider are there are now more testing kits available for COVID-19. So although there's more testing kits available, and you would think that this would increase the number of diagnosis of COVID-19, however, people are more likely to be diagnosed quicker, which should help to decrease community spread. The other thing is that now that we've had coronavirus for the good part of the last year, you would expect that people are more aware of the virus, the way it works, what they need to do in order to prevent spread. So you'd expect people to social distance themselves, wear masks, and also follow the other hygiene measures that will help to reduce the spread of the coronavirus. And we also hope that with the advent of a vaccine being available, scientists are working around the clock all over the world to make one available soon. So we hope that once this does become available, then this will also help to reduce the spread of the coronavirus. So do I think coronavirus will be worse in the winter? So before I discuss that, let's get into a new set of clothes. Okay guys, so finally going back to if I think the coronavirus will be worse in the winter, what I would say is I can't be 100% sure and only time will tell, but I think there'll definitely be a big spike in the rates of COVID-19, and this is due to several reasons. The first is I think people will become more relaxed with the rules. They'll maybe stop socially distancing themselves the way they should, stop wearing masks and start to mix with one another again, as has been shown with some of the local city lockdowns of Birmingham, Manchester, Northampton, and also in some other parts of the world. People are now travelling more. People are also returning back to work. Also, schools have now reopened in most parts of the world and children are going back to school. I think all of these factors put together will increase the rates of COVID-19 infection again, especially in the winter. However, the other important thing to note is, especially in the UK, which has the National Health Service or the NHS, usually in the winter, there's a winter crisis from the flu virus, where there's long waiting times to see a doctor, or there's lack of beds available to treat patients. I think there'll also be more complicated and severe cases of COVID-19 in the winter. As I mentioned before, I think this will be due to the long waiting times to see the doctor and the reduced availability of beds. So guys, please leave any comments in the YouTube description below of what you think will happen in the winter period. And if you're new to this channel, then please consider subscribing so that I can continue to bring you valuable medical content to your doorstep. Thank you.